Professor Trevor Duffy of the Irish Medical Organisation. From your perspective, what are the main challenges on both sides of the border?
I think that the challenges across the border are really how we continue to work together. I mean, over decades, we've incrementally developed a health service that is mutually dependent and enmeshed across the border, and the patients are getting a superb service as a result, much better than they get out of either side singly. And it's how we protect that, how we protect that when there are regulatory challenges to free movement of individuals, free movement of pharmaceuticals, free movement of data, and it's really, it all comes down to kind of the regulation, the regulatory framework that's allowed that collaboration happen, and that's under threat. So that's the challenge to us.
Have you been in contact with the government, and are they listening to your concerns as a medical professional?
Yes, yes, we have. We've had several contacts, kind of unofficial and official, I suppose culminating in a presentation ourselves and BMA Northern Ireland gave to the Oireachtas for their review of the challenges of Brexit, and they listened, and they included our recommendations in the report. So they are listening, but they face the same difficulties as us, I think, really, and that's that nobody knows where the regulatory framework is going to go. I mean, over the years as medical professionals, we've always collaborated where need exists, but proper regulation allows that to happen efficiently and effectively. Bad regulation can hamper it, and that's what we fear we're facing.
You gave some very interesting examples. For example, in the field of public health, what does cooperation mean?
Well, public health is all about the health and well-being of populations, and one of the biggest threats to the health and well-being of population is infectious diseases. And infections, particularly viruses, don't recognise borders. And we've seen many examples of that. We've seen CJD many years ago and how that impacted farmers and farm herds and public health. We've seen foot and mouth slightly more recently. And then more recently again, we've seen the SARS virus. And that's no respecter of borders. And indeed, kind of addressing those public health challenges has led to tighter integration of our public health services across the border in a very effective manner. And that's under threat now, because public health initiatives really require on population-based interventions which require regulatory frameworks.
Ireland's attracted a large number of very significant global pharmaceutical players. Is this an opportunity for you?
Yes, I suppose it is. I mean, Ireland prides itself in its can-do attitude. We pride ourselves in our openness to industry and innovation. And certainly there are opportunities for pharma companies, for healthcare companies, healthcare industry that wants to use Ireland as a base in the EU. But as a medical professional, while I think we need to kind of see the opportunities, see how we can be at the forefront of continuing to evolve European collaboration, I think that the sense of doing it when you're pitted against one another in an unnatural way is not terribly comforting. So while there are opportunities, it does leave a kind of slightly uncomfortable taste as well.
Overall, what would you say is the single biggest issue for you? What would keep you awake at night worrying if this negotiation was not successful?
In terms of healthcare, I think the area that probably presents most threat to it is probably around public health regulation, because public health initiatives, as I said, really depend so much upon regulatory framework, good governmental cooperation. I think that's the area that's most under threat, and as we've seen, when they happen, thankfully they're rare, but when public health challenges happen, the potential impact is enormous.